I've had every non-operable procedure that we can try, like chiropractic and acupuncture and physical therapy, and nothing worked. My name is Dan DiBiase. About 2 months ago, I had spinal surgery at Community Medical Center.
When Dan first came to me, he had complaints of predominantly severe leg pain, weakness, numbness, tingling, and back pain. I suspected he had fairly significant arthritis in his lumbar spine, so we ordered an x-ray and then I got an MRI to confirm that he indeed had very severe degenerative disc disease and arthritis in his back that was squeezing his nerve roots that was leading to his leg pain.
It was the type of pain where even if I tried to work through it and do stretching exercises or any type of exercise at all, it was almost impossible. I couldn't do it.
He was in a lot of pain all the time, a lot of moaning, couldn't sleep long, was sleeping maybe 2 hours at a time.
So it got to the point where Dr. Sean suggested that probably the only thing that's going to help you is if we do surgery.
Because of the extent of his degenerative disc disease and how severe the arthritis was in his back, he required a 2-level decompression that we call a laminectomy. We remove the arthritis, we remove those degenerative discs, we make space for those nerve roots, and that's to address his leg symptoms, his leg weakness, his leg pain, his leg numbness. And because we're removing this section of his spine, it results in some instability, so we have to stabilize it, and that requires putting in some screws and some rods and some cages to reconstruct his spine once I decompress it to make room for his nerves. We utilized the new spinal navigation pulse technology to help navigate the process of putting in screws into your spine. This allows for a more efficient and predominantly a more safe manner in putting in hardware. It's a really remarkable technology that we have now here at Community Medical Center.
I see an improvement all the time, I really do. I just can't wait for him to get back to golfing, get out of the house.
The goal is to get him back to playing golf, to get him back to doing the things he loves to do without pain in his back, without pain in his legs.
As far as what they did for the pain going down the leg, the laminectomy, I mean, that was gone the next day. So, I mean, I knew that that was a step in the right direction because that was the big problem right before the surgery.
He was very satisfied that his leg symptoms were gone. He's now undergoing the process of rehabbing the back pain that he has right now, and that's mostly from the surgery itself, the trauma of surgery itself. He's already well on his way to an excellent recovery.
It was a good experience. It was, you know, I knew I was in for a long surgery, which is scary, but I felt comfortable from the moment I got to the hospital through the entire stay. And, you know, I mean, the nurses, when I was in recovery, were great. They were very responsive. It was just a good all-around experience.